important thing for you to understand and to think forward in order to avoid the problems that it can generate during treatment is the position of the incisor related to the resting position of the lip. So when you have a patient with less exposure, for example, than 2 millimeters or 1 millimeter in a rest position of the upper tip of the upper incisors, the tip of the upper incisors, so it resembles aging. We know that people don't want to have this appearance of aging. Of course, we have to respect. I'll show you that each age has its charms, but we know that people want to show less age than they really have, than they really are. But for that, we can do with our treatment plan, doing the proper positioning of our brackets. We can show more or less incisor tips, doing the right positioning right in the beginning of the treatment, an orthodontic treatment. So this is something very important. We know that men and women tend to feel better with less or more exposure, and I always ask my patients, what do you want for you? Do you want more or less exposure of the incisor in a rest position? So I show them examples of both less and more exposure of the tips of the upper incisors. So I let them together with me choose what's the best for them, okay? But we can do this in the beginning of the treatment. We can do this with the right position, with the right positioning of the brackets during the initial phase of orthodontic treatment. That's important. And we know that with aging, we show less upper incisors and more lower incisors. In orthodontic treatment, we can change that also. We can treat age. How? We can just intrude upper, anterior, lower, and extrude upper. It can be by means of orthodontic surgery or extrusion using skeletal anchorage for that, or even with elastics. So we can do anything, just we have to plan for that. What I mean here is that if we want to change the exposure, to change the youthness of the face, we can show less or more incisors, and orthodontically speaking, we can do that. Of course, we have to respect the age of the patient. We can't change completely the outcome, the features of the patient's age, but we can tweak a little bit that. It's very important. It's very, for me, this quote here is very interesting. Aging gracefully is better than keeping up a facade of eternal youthness. So we have those beautiful ladies here, one of them my mother, another my daughter, and you can see that they have different exposures. You can see that they have different and proper exposures for their ages, but it doesn't mean that we cannot treat a little bit this age doing this kind of movement, extrusion, special extrusion of upper teeth. For example, here, if you look at this image here, you would probably pick like 50 years old for this lady. You probably guess she's 50 or more than 50, and for her, I'm sorry, she would show more incisor tip that she shows in a rest position. So we can do that. We can do that orthodontically. 0 millimeter exposure, meaning negative exposure in a rest position, is not good, and you can ask your patient what they prefer. For example, 1 millimeter is better than 0, but for me it's not enough. For me, something like this, 2 millimeters is good for this youthness preservation, so we can preserve youthness using this kind of trick, showing a little bit more exposure of upper incisors. More than that, some people like, others not, and we have also the excess of exposure. If I ask you to choose between all these 5 pictures here, you would probably be picking the number 1 or number 4. It's the medium of people who choose this as the best feature of exposure of the upper tip of upper incisors, okay? But one other thing that you can choose is the step between central and lateral incisors. We can do that. Orthodontically speaking, we can do that since the beginning, since the positioning of upper teeth brackets. And we have to choose based on patients' beliefs, based on patients' preferences. So I ask my patients, what do you want? Do you want a 0 millimeter of step? And I explain them what step means, and I explain them that I can change that. And I ask them, what do you prefer? And I know that step is beautiful because many people likes this kind of step because it also resembles youthness. So many people that don't have steps, they are beautiful, but when we have this beautiful step, this is my personal belief. Of course, there are many articles that don't show the same thing for us, that shows that people, it depends on the culture, depends on the place. You're asking people about this kind of exposure of central and lateral incisors, but here, at least in my culture, in my country, we tend to like a little bit more step, especially in women, okay? With women smile. So we have here this beautiful step, and even though some people don't have perfect teeth, the step gives them this beautiful aspect of youthness. Both women and men. Some men don't like the step, I know, but I really think it's beautiful, and we have the opportunity to ask our patients if they like that or not. Many of my patients would prefer the step, the presence of the step, like 1 millimeter or even more than that. Half millimeter is almost not perceivable, but after more than that, 1 millimeter, 1 millimeter and a half, I think it gives us this beautiful smile, which tends to give us a consonant smile with the smile arc, giving that curvature that we like. So during the first phase of treatment or orthodontic treatment, putting braces in position, we can change the height, and we can do this kind of step, just choosing the position of the brackets in the lower part of the arch, okay? So this is something that I like to ask my patients because I can change. So if I can change, I can give my patient this option. And if we want to do more or less step, it's up to our patient, but we have to show them how they can do this, choose this kind of steps. What I do is show them this chart, showing 0 step, 1 millimeter, half millimeter to 1 millimeter, and more than 1 millimeter. And I always play with this kind of exposure in order to achieve this response of my patient, if they like or not the step. Because in my opinion, to give the patient the best that he can achieve is that what differentiates you from other orthodontists. And I want to give them the best always. I want to ask them what they think is best, what's better for them. Do you want the step? Do you want to have this more exposure? What? And sometimes I try, speaking with the patient about many things, I try to squeeze out of them what is his preference or her preference about their faces, and what they really want to change. Because sometimes the chief complaint of our patient, it's hidden. They don't say loud. They are a little bit embarrassed of saying that they want to change their facade, they want to change their profile, they want to change because they don't like their smile and something like that. So I try to squeeze it out of them, asking many questions and asking what would they prefer about this or of that feature, and sometimes I manage to understand better what they want. So one of the things that I consider that can give that plus in our treatment is giving the best step, the best exposure, and that we can determine at the beginning of the treatment, okay? So the step is one of these things, and the exposure of the upper tip of upper incisor related to the rest position of the lips. This is very important, and it gives really a beautiful and sometimes we we can even say more sexy appeal, sexy face, if you can say that. But there is something that no of my patients would like, which is an asymmetric step. So when you have an asymmetric step, due to our own errors, due to our own mistakes in the beginning of our treatment, just putting the braces in different positions, the brackets in different positions. So sometimes we built this asymmetric steps. So this is something that no one likes, and we have to ask patient, which one do you prefer? In this case, my student was one of my students. She was treating, and she was in this phase of the treatment, and I asked her, what is the step that you prefer? And she told me, Kleber, I'd like to have this step. I don't like this much of this step in the left side. And what I did was to do the correction by means of bends, in this case, a step down bend or extrusion bend. So we can manage to do this modification if patient don't want during the treatment, but at the beginning of the treatment, we can also do this, avoiding sometimes the need for doing this kind of bends during treatment, because we anticipate the mistake and we did it before treatment. This is very important. So sometimes we can do this in order to achieve a better exposure of the smile arc, and we are going to do this by means of the bonding, or if you already bonded, and if you have already bonded your patient and you didn't manage to do that at the beginning, you can change this doing this kind of bends that we will see thoroughly during our course. But now, just for an example, I'm going to show you this step down bends. They are made in order to have that beautiful smile arc. So we can do that both by means of bonding at the beginning, different heights of the incisor brackets, or if you want to change or even increase that step, you can do that in the course of your treatment. Okay? So this is here that we stop with our pre-treatment, and after that we go to the treatment and the problems that we have during treatment, and we will change them by means of bands, loops, and elastics. See you later. Bye bye.